Tinnitus is basically abnormal sound in the ears. That means other than the normal sounds which are around in the environment, it's a sound which comes from, actually is produced from, say, within the ear. So it can be in the form of, ringing or whistling of the wind. So various types, or buzzing sound. So it's something like that. It may affect one ear or it may affect both the ears. The root cause of it is there is some weakness which has come in the part of the ear which is involved in hearing, and the nerve which goes from the ear to the brain. So somewhere in that area, some sort of weakness has come in, and which is causing this sound to come. There are various diseases and all which may lead to tinnitus, like diabetes is one, sugar being high one, then some even kidney diseases all can affect and cause tinnitus. Till date, there is no definitive cure being found for it. There are various types of modalities of treatment of managing tinnitus. The first most common generally thing told to patients is to just ignore it, and get used to it and just ignore it. The more a patient becomes conscious of it, the more patient gets troubled by it. Of course, as I said, first important thing is that we have to see that can we find any cause for it. That means is there something going on in the body somewhere which may be responsible for this. So for that we need to do routine some of the blood investigation tests and other things. And if we find some possible cause for it, then we treat that particular. Other than that, as I said, majority of the cases one may not find any cause. So in which case, there are some medicines available, medications which can be tried, but there is no particular one particular drug or something which can be said that this is the treatment for tinnitus. Then third is, then there are things called available in the market which are called as tinnitus maskers. They are something like a hearing aid which produce sound, which sort of noise or sound which neutralizes this sound. So frequency matching is done with that tinnitus sound, and then it neutralizes that sound. And then similarly, patient even may need to undergo relaxation techniques or biofeedback to help cope up with this tinnitus. It can last forever. Sometimes, as I said, that also that it can be continuous, that means just throughout the day, or it can be intermittent, that it occurs sometimes it's not there, and it can go on for a lifetime. There is nothing hard and fast about it. As and when you develop tinnitus, and if it, let's say, remains for more than a day or two, one should go and get yourself checked up by a doctor, or especially, in fact, in this case, it should actually consult a ENT specialist to see whether what could be the cause for it, and if possible, at that early stage, whether some sort of treatment can help get rid of it. Well, one common cause of tinnitus also is due to, let's say, exposure to loud noise, loud sounds. So in that case, if one avoids exposure to loud sounds, so especially like people who go to this functions and all, or even parties where music is playing very loud for a long period of time, and they get exposed to that. So loud sounds over a period of time may end up causing tinnitus, because that can damage hearing, and in turn, the damage to the hearing part in the body may lead to tinnitus.